everybody. Welcome and thank you for joining us once again to an episode of Tech Safe here in Worcester, Massachusetts. We're so very grateful to our hosts at WCCA TV. And today we're going to do a couple of things. First, we're going to talk a little bit about the science, because when we first opened this technology safety conversation, people aren't even aware that there is such a depth of science on this issue, because we simply don't hear about it in mainstream media, because mainstream media is by and large funded directly by the telecom and the wireless industry, or their advertising revenue controls what messaging we get. So I want to start off with great thanks to a couple of the scientists in this space. One is Dr. Joel Moskowitz, who just completed a webinar through the Collaborative for Health and Environment called Health Hazards of Wireless Technologies. What do we know now? So I will direct folks who are interested in learning more about that to Dr. Moskowitz's website. He is the director for the Center for Family and Community Health in the School of Public Health at the University of California, Berkeley. And his website is saferemr.com. So SAFER, and the EMR stands for electromagnetic radiation. saferemr.com. So please, you can go out there and watch his talk. You can look at his slides and really come up to speed on what the science is trying to warn us about today with the biological and environmental effects of today's wireless technology. And then I also want to extend our gratitude to Dr. Henry Lai, Professor Emeritus at the University of Washington. He's also the editor emeritus, and when I first fell down this rabbit hole, I didn't know what the word emeritus means. It means they have retired from their positions with honor. And so he was the editor emeritus of the journal Electromagnetic Biology and Science, and he is also an emeritus member of the International Commission on the Biological Effects of Electromagnetic Fields. That is a good group of scientists who are there just to teach us the science, and they are calling this wireless radiation electropollution that we are also immersed in a public health crisis right now. And they've got a really good statement you can read out at their website, which is the ICBE-EMF, so International Commission on the Biological Effects of EMFs. So back to Dr. Henry Lai, he has compiled summaries of the research on biological effects to this radio frequency radiation and the extremely low frequencies that are called ELFs, as well as static electromagnetic fields, which are these EMFs. In a nutshell, it's all these man-made energies that are biologically affecting our cells' response to the environment. And so his set of abstracts cover science from the period of 1990 to October of 2024, so very current, and it's a comprehensive collection of the research. Dr. Lai reports that the preponderance of the research has found that exposure to these man-made frequencies produce oxidative effects or free radicals and damages DNA, which we know is the roadmap to grow a proper anything. Moreover, the preponderance of radiofrequency radiation studies that examine genetic, neurological, and reproductive effects has found significant effects. Among hundreds of studies on this radiation, 71 to 89% report significant effects. Among hundreds of studies on the ELF or the static fields, 75 to 90% are reporting significant effects as well. Again, we just don't hear about it in mainstream media, but we're so grateful that this research is right there for us to be able to access. And again, with gratitude to Dr. Joel Moskowitz at UC Berkeley, he has been tracking the science and actually contributing himself as a scientist for several decades now. And he makes it very easy for us to get out there and look at all of these studies. And currently there are about 2,500 studies in Dr. Henry Lai's collection of research on the effects of exposure to these man-made energies. So feel free to go out to saferemr.com and just start poking around and seeing what you can see, because if we're only getting messaging from industry, or if we're only being told about industry-funded studies, We are not getting a balance of information on which you and I can make our informed decisions about what we want to expose ourselves and what we don't. So, that being our science update, I now want to introduce you to one of my favorite people in the whole world. It's my girlfriend, Gina Lauria. Gina and I grew up on the same block together when we were 11 years old, and we have been lifetime friends for the last 50 years. So, Gina, welcome.
Thank you.
And the reason I asked her to come on, she lives out in California still. I'm here in Massachusetts. But what happens often when we open the technology safety conversation with friends and loved ones is a very common response is, well, I don't feel anything. I'm fine. I'm going to keep doing what I'm doing. And so I just share that, well, you might be fine today, but it's cumulative, like any toxin, it's cumulative with dose over time. So today might be the day you feel great, tomorrow might be the day you hit that tipping ground. And then other people will say, oh, we're all going to die anyway. But on occasion, you have somebody who knows you and says, what? Tell me more. How can I learn more? Where can I go research this? And thankfully, Gina is one of those people. In fact, when she was at my house a few years ago and I was telling her about what wireless is doing, and I was using a radio frequency detection meter, and first I showed her the legal fine print in her phone that says, keep this device away from the body, and it's invisible, so how do we know? So I busted out my meter and I measured her cell phone, and it went right into the red. It was off the charts. And she took her phone and she literally
Blew it.
chucked it across my living room on the carpet so it didn't break, but she got it. And so I invited Gina here to join us today to tell us from there, what other things have you noticed? And then we'll talk about measures that you've personally taken. And then we'll talk about what you do in your professional life as a property manager.
Great.
All right, so tell us what flew through your head when I started teaching you about this.
Well, first of all, when Cece started teaching me about this, I knew that she was instrumental in putting Wi-Fi into the schools, and then I knew that she learned and was instrumental in trying to educate the schools on the safety of it.
And so many of us were on the wrong side of this, and we had no idea. So, Gina, talk to us about what you've done and what you've noticed now that you understand what the risks are.
Well, first of all, I'd like to give my explanation of how I came to feel this effect. And I was here visiting you a few years ago, and we went into a big box store. And the only way that I can explain is that I felt like my brain was defragmenting, just like a computer, and that my brain was buffering. And if I would turn my head, it would take a split second for my brain to go with my eyes. And that felt extremely confusing to me. And I immediately left that store, but before I did, I looked up, and there was a huge router with a whole bunch of antennas. And it probably took a couple of minutes of getting out of the store for my brain to feel right again. So that was my first experience. And then back in California, oddly enough, I went into the same big box store and felt the same experience. So, and my big box store is closed now, so I don't have to worry about it anymore. But that was my first experience in learning what it felt like and how uncomfortable it was.
Yeah, and how fortunate that you could just leave that store.
Yeah.
And within a few moments, your body could recover.
And it does take a few moments. It's not instant that your body recovers. So,
and sometimes people get such a large dose that it really takes them down, and then they are forever electrically sensitive, and they can't be around anything that's transmitting because it will trigger all these symptoms. You were experiencing the brain symptoms, there are cardiac symptoms, there are skin symptoms, and it just goes on all the way to infertility and cancers, DNA damage, as Dr. Lai and Dr. Moskowitz are trying to teach us. So, yeah, it's eye-opening once you have enough information to assess your environment and go, could that thing be affecting me. And once you put those pieces together and you remove yourself and you feel better, well, there's your answer.
It was such an awful and confusing feeling that you think that your brain is going to fail in some way. It was really kind of frightening.
So then, we talk about baby steps because we know this whole issue can be very overwhelming because literally it's everywhere, except for the areas that we can control. So I noticed before we got live today, you said that your cell phone was in airplane mode, and that's a great first step. If you're not using the cellular antenna, the data antenna, the Bluetooth, the Wi-Fi, the locator, the hotspot, the 5G, all those are separate antennas in each one of our devices. All we have to do is go into settings, and one by one we can turn it off. And then if we need to use a mobile device, just go in and turn on the one antenna for the shortest amount of time that we can. And today, the U.S. Centers for Disease Control and Prevention, the CDC, they have something called the ALARA principle, which stands for our goal is to get to toxic exposures as low as reasonably achievable. So they talk about the sun and the gamma rays and the X-rays, but because, as Harvard University points out in their Captured Agency report, a lot of our federal organizations and agencies are now run by the industry. So we have been trying for years to get them to update their wonderful page that talks about the ALARA principle to include all of this other man-made radiation. So they talk about ionizing radiation, which has enough power to break the atom. But this non-ionizing radiation doesn't do that necessarily, but there's so much harm happening at the non-thermal, non-ionizing level. So what they encourage us to do, and we kind of think this should go with all radiation, spend as little amount of time radiating yourself as you can, which is kind of common sense, right?
Yeah.
Even in the cell phone, if you look at the legal fine print, if you go into your legal and regulatory section, it will tell you we tested this at a distance from the body, so don't put it on your head, don't do that. So create distance, spend as little time radiating yourself as you can, and then if you can't get away from it, hire a professional to help you shield. And one of my prior guests was Ken Gartner, who has recently completed his certification in building biology. He was trained at MIT as an engineer, had a great career, and then went into retirement. And when he built his dream house with his sweetheart, they didn't know any better, and they put a smart meter on the house, and it just took his sweetheart down. All that radiation, night and day, pulsating at her, and now she is disabled to the point where she's pretty much a shut-in. So learning about this is great, but it's a lot. We get that. So let's talk about the baby steps that you started taking to protect yourself.
Well, the first thing I did was got myself one of the safe and sound meters and took it home. And I took it in every room of my house, and I found the green zones, and then I try and duplicate those green zones everywhere else in my house. One of the big things that I did was I had Ethernet cables wired through my attic into every room in my house, and they turned all the antennas off in the computers. I hardwired all the computers, all the printers. I work from home. So that was one big thing that I did. And I have grown kids, and one of them's a gamer, and he was the one who said, "Mom, you'll get a much faster signal if you go through Ethernet, so it'll be better for you anyway." So I'm really trying to make my house a safe zone, a green zone. Another thing that I did was my modem that brings the wireless in, I wasn't able to turn off the antennas. And so I went ahead and got an eco modem and installed it. And I'm not a tech person, and I took this modem out of the box and looked at it and got overwhelmed and left it on the counter for a couple of days. And when I finally said, okay, I'm going to try this, and if it doesn't work, I'm going to spend 4 days on the phone, it was amazingly easy. I just unplugged certain things and plugged in certain things and read the directions, and my old router with all the antennas is in the mail back to the cable company. So
Excellent.
I'm happy about that.
Excellent. And you bring up such a good point. We have solutions for everything. I think that was the JRS Eco Router that folks can go online and buy. And you can, I think, completely disable the antennas, or if for whatever reason you need to have Wi-Fi at certain points, it will only transmit when there's something trying to connect with it. So that's the eco feature in that. So, and that's something that anybody can do. And I remember you called me up one morning on the weekend and you went, "Hi, I just had the worst night's sleep and I couldn't figure out why. And I came downstairs and right under my bed was my kitchen counter and I had left my cell phone on in my purse. So it pulsated all night long." And we know biologically that that's doing a number of different things, but protecting our sleep is so important because in our circadian rhythm, in the wee hours of darkness, our pineal gland in the brain releases melatonin. Melatonin's job, pretty important, it goes in and regulates our sleep, but it also helps to clean out the toxins of the day. And unfortunately, the brain, the melatonin, gets screwed up when this invisible light form is left pulsating. And so our brain can't distinguish between natural daylight and this invisible man-made energy. And it's over there going, do, when's it going to get dark so I can release the melatonin? So it's nice that we can even explain this because we didn't have all the science, until more recent years, where we know what it's doing to our blood, we know what it's doing to our brains, we know what it's doing to our reproductive organs. And these studies have been repeated. So we have excellent science out there. We just need help, which is why I'm so grateful you agreed to come on my show with me today to get word out to the public.
Can I tell you one thing that I noticed is I think we all think it's normal if we're not sleeping through the night or belong to the 3:30 a.m. club where we wake up at 3:30. And I just thought all that was normal until I went and slept in a green zone, or until I come to Boston and sleep in Cece's house, which is a total green zone. So I can wake up in the morning with open my eyes, very serene feeling, think of how I'm going to start my day and thank the Lord that I woke up today. And that should be normal. That should be everyone's normal. And I think that if everyone can sleep in a green zone, that everyone can feel that and they don't have to belong to the 3:30 club or wake up in chaos club. It doesn't have to be that way.
Excellent. Yeah, same thing when we hardwired my house. I noticed I started sleeping better. My daughter's headaches and nosebleeds all but disappeared unless she'd let herself get dehydrated. So yeah, just little baby steps. And we have so many resources. Folks can go out to the Building Biology Institute. They've got some good fact sheets on how to create a sleep sanctuary. So one by one, you just notice where your exposures are. If you can get a hold of a good meter, this again is a Safe and Sound Pro 2 that was recommended at the EMF Medical Conference. I became the first in the nation to put a meter on loan in our public library, and folks thought that was a pretty good program. So now others are working with their libraries to get a community-based meter. It's about $400, and oftentimes library budgets now have that sort of money set aside for their library of things. Now that people aren't always holding a book to read, they've broadened what they offer through the library, and they have a lot of stuff that they loan out to their patrons. So this one's about $400. It's got like a little baby sister one. I prefer the Safe and Sound Pro 2 myself, just because it gives me the digital readout, and I know that science wants us to be at 10 or less on the maximum spike of these pulses of radiation that are coming at us at millions and billions of cycles a second. We want to be at 10 or less. So that's helpful for me when I'm teaching.
Okay, so in my home office,
Yeah.
410,000.
Woo.
410,000. That's a lot higher than 10. And before I got the router, you told me get a timer. And so I hooked my old router up to a timer and turned it off at night, and that was a great thing that helped.
Yeah. protect that sleep, first staying out of the gate, and keep your phone in airplane mode if you're not actually using it. Messages will still come in. You can turn your phone on for a couple of seconds, and then it will upload, download whatever text and stuff, and then put it back in airplane mode. On the iPhone, look and make sure that when you turn airplane mode on, you also turn off Bluetooth and turn off Wi-Fi, because they come back on their own volition sometimes. If it just says not connected, that's not good enough, because remember, this is a two-way signal. So if it just says not connected, it means your phone's still going, here I am, I want to connect. So make sure all those antennas are off. But here's another little meter, teeny tiny pocket-sized one, that our friends at Safe Living Technologies puts out. It's called the Safe and Sound Classic 2. They might even have a Classic 3 out now, but this will just tell you basically red, green, and yellow, and then give you ranges of where you are on this. So hopefully meters within different budget classes. I wouldn't go any less than this. Somebody got their library to buy a meter, and it was a much lesser quality, and when we put the 2 meters side by side, that little, I think it was a GQ 90 or something, it was missing a lot of the signals that the more highly calibrated meters will pick up. So Gina, you have built yourself a wonderful business as a realtor, broker, and property manager out in Simi Valley. And we've been having talks about nationally, we have a housing crisis. And then there's a subset of people who have become sick from all these electromagnetic radiation pulsations. And we need to start opening conversations. How can we get safe housing, especially for those who are low income and may live in subsidized housing, senior citizens, those with disabilities? And I know that you service a certain percentage of that clientele in the buildings that you take care of. So talk me through where we are today, and I know the conversation is just starting, but how do we have these meaningful conversations to try and get safe and secure housing for people with electromagnetic sensitivities and multiple chemical sensitivities? Because our Americans with Disabilities Act has long since recognized for 20 years that these are real. They're not made up. They're not psychological. They are illnesses induced from our environment. So share your thoughts with me.
Clearly, there is not enough housing for people who are chemically sensitive or sensitive to the 5G. There's just not enough. I will tell you that I manage a little 9-unit apartment building that had 1 electric meter, and we split everything out. So now it has 10 meters, but they're all on the back wall, which is on the other side of a downstairs and upstairs apartment. And when we put the meters in, I had a dear Vietnam vet in the upstairs apartment that absolutely said something's wrong. I don't know what's going on, but I can't stay here anymore. And I knew the meters just went on the back of the building, and he was in a lease, and we absolutely let him out of his lease, knowing that it could have something to do with the smart meters. So those are things that we're doing, but clearly there is not enough housing that supports people with these sensitivities.
Yeah, and I'm very grateful. We have some colleagues who for years have been working at the federal level with the National Disabilities Council, and they are starting to recognize that we need to start doing something about this. So with great thanks to Elizabeth Kelly, who put on the Electromagnetic Fields Medical Conference, which is now available at no charge for everybody to be able to go out there and learn about wireless radiation from world-leading doctors and scientists, not only what it is, but how to recognize it, diagnose it, treat it, and most importantly, prevent it. So Libby Kelly, Dr. Magda Havas, who was a co-chair on that EMF medical conference, she's a professor emeritus from Trent University up in Canada, and she taught EMFs for 2 decades up there. And Sheena Symington, who runs the Electrosensitive Society, Susie Malloy, who has been working from an advocate standpoint and public health standpoint. They are still working with our federal offices to try and get ahead of this. So there's a lot happening. But again, it comes out of left field for most people when we say there's an invisible exposure here that we really need to understand. So every month I do free public education webinars through Massachusetts for Safe Technology. So anybody's welcome to go out to my website, go to my events page, and you can register. And we've got them coming up at the end of October. We've got them coming up in November. So we'll be posting the November date soon, and we invite everybody, just come learn. You know, we say don't take our word on any of this because it seems like science fiction. But it's very real, and when you start looking at the science, we understand that.
And a lot of people, you can't see it, it's invisible. So if it's invisible, it's very hard to tell people, hey, this is a toxin that you need to think about.
Yeah, and so I know a doctor here on the North Shore who got one of the EMF meters after the conference, and she loans it out to her patients for $10, so they all share the cost of it, and she says, you've got 2 hours, now go home, do your scavenger hunt, and get the kids involved in the scavenger hunt. They love doing stuff like that. And then you're not just the one person in your house going, rah, 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 rah. Get everybody involved at the ground level and measure, and then the patients go back to Dr. Aaron Acevedo up in Beverly, and they fix it. They tell them how to fix it. So, Gina, I want to thank you for being such a love of a friend all these years, and for your moral courage to listen, go check it out for yourself, and then to recognize that, hey, why would I sit here in this electromagnetic soup when I can just start swapping out, Ethernet cables for wireless antennas, right? And this
Get my house to a safe zone.
Yeah, this is all this is. This wireless antenna was pulled out of my television set because there was nothing in the controls that would allow me to undo it. So it's not rocket science to fix. I had a trained professional techie do this for me, but I had the one on my stove unplugged by the technician who was there to service my stove. So we can do it all. And Gina, you really inspire me because you're a mom. You get it.
Yeah. We didn't get a chance to talk about kids on devices and how much time that they should spend, but I think that's a really important issue too.
And Gina and I went to a community book talk in my town of Ashland that our town social workers put together this week on the new book by Dr. Jonathan Haidt out of New York University. He's a social psychologist, and he's basically saying in his book, the anxious generation that we traded in our children's childhoods when we started giving in these devices. So we'll be having more guests on to talk about that in the future. So with that, everybody, have a tech-safe day and just keep taking those baby steps towards safe technology. Take care.